Hi, Dr Alex Perry here from the Blue Sky Chinese Medicine Clinic. Today in this short video I want to talk a little bit about Chinese medicine and the three key principles. So whenever we talk to patients about their health, we talk about these three key principles of Chinese medicine that govern good health and therefore also explain ill health. So I wanted to talk about this in a little bit of detail so you understand a little bit about where the Chinese medicine perspective is coming from when it comes to your health. So there are three key elements. The first element that I want to talk about is a Chinese word which is qi, spelt Qi. Now qi is the same qi as in Tai Chi, and it's a word that is used commonly to describe energy. So whenever we talk about qi in the body, often we're talking about energy, but energy to me is only one aspect of what qi actually is. To me, qi is less a thing and more a way of describing anything in the body that has a functional component. So qi is the functional stuff. So qi describes anything that is in your body that provides function. So movement, thought, the electrical impulse that causes your heart to contract. Traditionally, this was all considered qi. And that's because, if we go back 1,000 years or 5,000 years when Chinese medicine was first developing, there was no concept of the heart as a muscle, let alone the electrical impulse that stimulates it to contract. So the way that they described things was to think on a macro sense, and qi was the word that described many of the functional aspects of the body. So whenever we think about qi, we certainly think about energy, but we think more broadly about what's happening in the body from a functional perspective. The second aspect, the second of our three important factors, is blood. And interestingly, the modern understanding of blood and the traditional understanding of blood from a Chinese medicine perspective are very similar on a macro level. So blood is a body fluid, it carries nutrient, it eliminates waste, it's moistening, it's cooling, it's nourishing, and it provides the nutrient to all the cells in the body. So on one hand we've got qi, this energetic, this functional component. Blood, we've got a body fluid component. And the third aspect, which is equally as important, is flow. So, in other words, for good health, you need an abundance of that functional stuff. You need an abundance of the blood or the fluid component. And just as importantly, you need those things to be flowing freely around the body so that, every cell in your body gets the opportunity to be bathed in both qi and blood, or they get the energy or the functional component as well as the fluid component. So I hope that makes sense. So, in a nutshell, Chinese medicine can be boiled down to these three factors. Now, we could dig deeper and think about organ systems and specific pathologies and all sorts of things. But I think at a kind of a basic level, at a macro overview level, if you can understand that you need an abundance of qi, blood, and that they move freely around the body, then that really is going to go a long way towards understanding what the Chinese medicine perspective on health is. So when we talk about ill health or disease, really we're talking about either an impairment of either the quantity or the quality of either the qi or the blood, or its ability to flow. So I can give you a couple of really easy examples. If we think about that qi side, the qi mechanism, if we look at it just from an energetic perspective, anyone who comes in with fatigue, for example, then whenever we think about fatigue or lack of energy, then we think straight away about qi, its ability to be produced via the metabolism, and what's happening from a qi perspective. And we would often describe fatigue as qi deficiency, not enough energy, if you like, to make sure that you've got the energy requirements for everyday living. Flow is an easy one to describe, because whenever things stop flowing, you get what we would describe as stagnation. I hope you can read my writing on the whiteboard. Stagnation just means that there's an impairment of that third characteristic, which is flow. Now, a good example is pain. Now, it could be a headache, it could be pain from a sporting injury, it could be chronic, it could be acute pain. Whatever the pain is, pain from a Chinese medicine perspective is always the inability of either the qi and or the blood to flow smoothly. So it's a little bit like having a blockage, and that can happen. A bruise is a good example. You have an impact injury to the body, you have localized blood stagnation, and then pain that follows. So stagnation is a really important way of understanding that impairment of flow can create or cause disease. Now, whenever we talk about disease is a really emotionally loaded word. I like to think of disease as dis-ease. Things not at ease, and the whole premise of Chinese medicine is that things work in balance and things work in harmony. So when things go a bit out of sorts, a bit out of whack, disease results. So from a treatment perspective, if there's stagnation, we try and remove the stagnation and improve the flow of things, and then pain often resolves. If there's a deficiency of qi or of blood, we try and remove that deficiency, increase the ability of the body to produce energy, get you feeling better, and then hopefully the fatigue or whatever else will go with it. So I hope that explains a little bit about Chinese medicine from a theoretical perspective. But if you can think about those three key elements, qi, that energetic functional side, blood, the fluid nutrient side, and their ability to flow smoothly through the body, then you're going to have a really good understanding of how Chinese medicine theory looks at your health and therefore your illness. So I hope that helps, and I hope to speak or meet with you soon.